Hi guys, this is Dr. Greg Scott, and I'm basically got a short video here trying to answer the questions of the who, what, when, where, why, and hows of functional medicine. Basically, what is functional medicine? And so before we get into that specific detail, what I want to do first is just kind of have a baseline understanding of where we're at today with like traditional medical philosophy. Traditional medical philosophy is known as allopathy. It was born out of heroic medicine, which is what I have a picture of here, and kind of the idea of, if you maybe have heard of bloodletting, where they drained you of blood. They thought that would actually make you do better, or maybe you've heard of when they bored holes in people's skulls in order to get rid of headaches. That's kind of the heroic medicine, which seems barbaric right now, but back at the time it was kind of mainstream and well accepted, even though it may have done more harm than good. So that was allopathic medicine at the time, and really what it kind of came down to is the idea of how you begin to treat things. If you were an allopath, then you believe that you would identify what the symptom is, and then use some kind of substance to get rid of that symptom. This is kind of the key factor, as opposed to homeopathy. The idea was that you would use something that would basically have the same effect as whatever the symptom is. So if you have a fever and you're a homeopath, then you use something that's going to increase your fever to get rid of the fever. If you're an allopath and you want to treat a fever, then you would use something that would normally get rid of a fever. So it kind of made sense to be an allopath. There was other kinds of medical philosophies at the time, including osteopathy. We have doctors of osteopathy who essentially merged with traditional allopaths, the medical doctors of today, naturopathy, and as well as chiropractic philosophies. They were all around the 1900s and kind of competing for space. So it's quite possible that microbiology, basically the study of bacteria and the discovery of antibiotics, they allowed allopathy to become the dominant medical philosophy today. And so that's kind of where we are today. Healthcare, it focuses on symptoms. Identify the symptoms and then get rid of those symptoms. And I think over the 1900s, especially maybe the second half of the 20th century, we really start to get an isolation of organs and regions of the body, and doctors that specialized on those particular areas but didn't really look anywhere else in the body, and how it may be connected to other things. So traditional allopathic medicine is very disease-oriented and basically symptom-oriented. And so I have on here, there's a pill for that. So whatever your symptom is, there's a pill for that to make it go away. And that's essentially what allopathic medicine is. And so how is functional medicine different? Well, okay, a couple things here. First off, Jeffrey Bland, who's a medical doctor, he is the guy who's essentially credited with founding functional medicine in the 1990s. I believe it was right around 1990 that he did so. He created the Institute for Functional Medicine. And functional medicine is different because it involves the understanding of the origins, prevention, and treatment of chronic disease. So essentially what that means, I'm going to explain what that means. If you have heartburn occasionally, it's not that big of a deal. It's okay to take Tums to get rid of it. If you have chronic heartburn, or if you have heartburn basically every day, and Tums won't take care of it anymore, you might go to the traditional allopath of your local medical doctor, and he might suggest that you take the purple pill. And what this basically does, this product, which the trademark name is like Nexium or something like that, it basically just makes your stomach stop producing stomach acid. And since stomach acid is thought to be the reason why you have the symptom of heartburn, if you get rid of the stomach acid, then you no longer have heartburn. However, at no point in time does heartburn. And that's where functional medicine comes in, where it does ask that question. And so for a functional medicine point of view, the things that we would want to consider and maybe look at is the idea is, well, is this person having a reaction to foods, maybe some food sensitivities that are being developed. Does this person have some kind of infection going on? Do they have Helicobacter infection, basically, a chronic yeast infection, something like that? There can be multiple reasons why somebody might have chronic heartburn. And so basically understanding those origins, what the underlying causes are, affects how we're going to treat it. And so if it is an infection and you get rid of the infection, then the heartburn goes away without having to tell the stomach to stop making stomach acid. And that's essentially what functional medicine is and how it works. So how is functional medicine different? Again, it addresses the underlying causes of disease. It recognizes the body is interconnected. Is a patient-centered approach to treatment. It focuses on interactions between genetics, environment, and lifestyle factors and each of their contributions to chronic disease. It's replacing the acute model of care, essentially emergency medicine, with a proactive, predictive, and personalized model of care. Now, when I talk about the acute model of medicine, basically, I'm not saying that it's bad. If you get in a car accident and let's say you're bleeding and you go to the emergency room, you're going to receive the world's best health care. And they're going to stabilize you in that acute type of situation, that emergency type of situation. But functional medicine doesn't address any of those kinds of situations. It's not even trying to. It's saying essentially that there's a lot of chronic disease out there, and we don't want to use that acute model of care for chronic type diseases. It's not the best way. And so why should you consider functional medicine? Well, functional medicine, more and more people are suffering from chronic disease. Includes autoimmune disease, arthritis, things like that, all kinds of chronic disease, diabetes, those kinds of things. More and more people, especially in America, are suffering from these chronic type diseases. So modern medicine will focus on the acute care, which doesn't really work when you're trying to treat a disease that maybe takes years to develop. Acute care models, again, they're not effective for treating chronic disease. And so to kind of bridge that gap, we take modern research, things that are being considered more for like the treatment of chronic disease, and bringing them into clinical practice. And that's what functional medicine is. So again, to identify underlying causes of disease as well. That's a big part of it and kind of our number one thing. And so hopefully this quick video helped you understand what functional medicine is. Basically, these three websites here is where I got a lot of this information. YourMedicalDetective.com, FunctionalMedicine.org, or FunctionalMedicineUniversity.com. So you can check out those websites for additional resources. If you have any questions, there's my email and my phone number. Feel free to bug me, and I'll try to answer anything in better detail than I have it done on this video. Thanks for watching.